So switching it up a little bit, we've been talking about radiation, but now going into surgery. So if a man has symptomatic prostatitis and he goes and gets surgery, would that just relieve all the issues?
It is a consideration. So I am no fan of surgery for prostate cancer. The best surgeons still leave 5 to 10% of men incontinent. Men get something called climacturia, where they ejaculate urine 20% of the time, and other problems, greater risks of erectile dysfunction and whatnot. But it is true that some men who have very troublesome, inflamed, chronically irritated prostates, if they have their prostate removed surgically, that those symptoms can improve. And if they get through the operation and they're not incontinent, they're not ejaculating urine, they could be better off in terms of their quality of life and their symptoms.
So there's this thing called chronic pelvic pain. Can you explain what that is? And then also, how many men are getting this after surgery?
Well, some men have it before surgery. So chronic pelvic pain is really very much in line with this whole idea of an inflamed prostate, prostatitis, and it is not a very well understood entity, just like prostatitis isn't very well understood. You mentioned it occurring after surgery. Well, anytime someone has a knife put to their body and has a body part removed, inevitably the surgeon's going to have to cut some nerves. Most of the time those nerves heal fine, but unfortunately sometimes the nerves don't heal fine, and maybe 5% of the time people will be left with chronic, ongoing, unremitting pain from the operation, which no one really knows how to fix. So I'd say it's maybe 1 in 20 patients or 1 in 30 patients has unfortunate chronic pain issues after undergoing prostate surgery. And actually, it's true for many surgeries, not just prostate surgery.
We've talked about surgery, we've talked about radiation, now going into hormone therapy. So how effective is hormone therapy for a man who has symptomatic prostatitis?
Well, it's a big price to pay, of course. When we talk about hormone therapy, we're usually thinking of Lupron. There's a much milder form of hormone therapy called finasteride or dutasteride. Those are the generic names for Proscar and Avodart. And they only block dihydrotestosterone, which is the testosterone that's in the prostate. So they have less tragic side effects than, say, Lupron does. Lupron, which takes away your libido and slows your metabolism and causes muscle wasting, all kinds of really big issues. To answer your question, we don't think of the stronger Lupron treatments as a way to fix prostatitis. It's just overkill. But we do think of finasteride, dutasteride, Avodart, Proscar, those medicines, as a potential therapy for inflamed prostates, because sometimes the inflammation may be related to the nature of what the prostate does, which it makes sort of a sugary fluid for the sperm to swim in. And finasteride and Avodart shut down the production of that fluid. And some men will have notable improvement in their prostatitis-type symptoms. Not everybody, but some do. The problem is that a minority of men that take finasteride and Avodart can also lose their libido, maybe 20-25% of men. It's reversible when the pill is stopped, if it's stopped in a timely fashion. But people need to be warned about that, and it, again, may come at too high a price to fix urinary symptoms, but flatline the libido.
I know one question I got on Helpline is, I had a patient call and they were concerned, they had a urologist where they were going for prostatitis and they got prostate cancer, and they saw a medical oncologist. They were wondering, did they need to see both doctors, or was the medical oncologist trained also to deal with the prostatitis and take all those issues into consideration?
Most are not. Since we specialize in prostate cancer, is sort of unique. We see a large volume of men with these prostate-related issues, and certainly we're qualified to deal with it. But your average medical oncologist is seeing people with very advanced prostate cancer, and they would naturally think about referring these kinds of issues to a urologist.
So next we're going into supplements and food. Is there anything that a man should be eating or not eating to help with symptomatic prostatitis?
Yeah, people oftentimes discover for themselves that certain dietary patterns are better or worse, and it seems like there are some stress-related components. People talk about asthma or their eczema getting worse when they're under stress, and men will also talk about their prostatitis symptoms getting worse when they're under stress. Eating refined sugars and high-fat diets, these sorts of things in some men will definitely make their prostatitis symptoms worse. So it's not like there's any black and white prescription you can lay out, but we do know for sure that there is some connection between excess stress and a refined sugar diet that can exacerbate prostatitis symptoms.
Is there any other lifestyle changes, like will exercise or anything affect it?
Well, I can't point to any specific study, but it seems like exercise is beneficial for almost everything. And it certainly does reduce stress. People that exercise regularly feel more robust and healthy and happy. And the stresses of life, relatively speaking, are diminished compared to the person who's unwilling to exercise.
My last question is in regards to imaging, and will basically any form of prostatitis affect the image quality or affect basically the reading of how that'll play out?
Yes, you can see prostatitis as nonspecific changes on multiparametric MRI and on color Doppler. The trained physicians that are reading these scans all the time don't really have much difficulty making a distinction, but there's a lot of people that are still in their learning curve with these imaging modalities and potentially could confuse prostatitis changes seen on imaging as something that might be cancerous. But the properly trained physicians aren't likely to make that mistake.
Thank you so much for watching. If you would like more information, you can visit our website at PCRI.org. Also, don't forget to subscribe to our YouTube channel. We come out with new prostate cancer videos every week.